So what does that? He should be able to identify what are the health problems in the population. Identify that. What is the health problem and why it is occurring, and try to find a solution for that. What are the health problems pertinent to that particular population? Because population keeps varying and every population have different issues. So as an assessment or analytical skill, the epidemiologist should be able to identify what is the problem. They should conduct surveillance activities, that is screening or surveillance. Constantly keep a track about what is happening. You should go on collecting data from the population. So surveillance means systematic collation, and analysis of the data of health-related events. So there is a big definition. So basically, we are collecting information from the people to understand what is happening, right? Then investigate that. Once you get the data, you should be able to investigate and what are the conditions, why things are occurring, and what are the adverse outcomes which is occurring in the population. And then apply. He should also be able to apply the good ethical practices and legal practices, especially while studying the population. We cannot just study and do any kind of research in the community. So he should have that skill also to have a ethical practice, okay, especially while data collection, dissemination, and use of the particular data. Should be analyzing the data and interpret whatever data we are getting from the surveillance. The epidemiologist or should be able to analyze that and interpret what is happening, not only from the surveillance data and from the epidemiological research what we are doing to identify what is the problem. So he should be able to interpret the data and come to a conclusion. Interpret that, okay? And then based on the interpretation, he should recommend. So that is what we were discussing about evidence-based, okay? Interventions and control measures in response to whatever they have found out for the disease. Evaluate the program, whether the disease or any public health program is going on smoothly, not smoothly, or where is the hindrance, what is it, why it is not going on. So we have to evaluate the program. The next, the skill, the domain, what we were talking about, health, okay? So how this skill is being used, knowledge about the disease, okay? How to guide the epidemiological practice. He should use the public health sciences skill to know what is happening to the disease or the population. What is the cause for the disease? How it has to be managed? How do we manage the population? That is the basic public health skills, sciences knowledge he should have. He should use the laboratory resources whenever needed. For example, if we have to test the water, take the water for sample for testing and identify what is their contaminant, or blood sample of the people, or the sputum sample, any needs to do. He needs to know all those. He should have the skills for laboratory testing. At least have the knowledge of what test and how it has to be done. There are other experts who will be doing that. Maybe microbiologists will look into more details about this. He should be able to apply the principles of informatics. Informatics is now basically having all the data management, how do we collect the data, how do we process the data, how do we analyze and support that. So this is the skill what is. Most important skill is one skill that every person, not only epidemiologist, any person in the healthcare should have is a communication skill. More so for the epidemiologists, because the epidemiologists, whatever they find, whatever they identify, they have to write report, they have to present it to the appropriate people, communicate to the community, what is happening to them, how do we prevent, and also inform that to the policymakers, and so that the policymakers can take appropriate decisions. So they should be able to demonstrate their communication by talking, by writing, and then they should be interpersonal skills should be there, because they have to work with the community. They have to work with the people. They have to work with the colleagues and the public. Okay. So they should use effective communication technologies wherever. How do we communicate? So you should use appropriate technology so that it can be communicated in a more effective manner. So communication skill is an important competency for an epidemiologist. The next skill is he should be able to provide inputs. Okay, the research skills, providing epidemiological input into the studies, into public health programs, community programs, planning, processing at each level, advice at the state level differently, at the local level, depending on the domain, depending on the region. We should we have to suggest people, provide inputs to it. Next, he should be able to participate in the investigations, in the development, community development, partner with the community, other community stakeholders, and do the investigations. This is another important skill that particular epidemiologist should have, and that's what they're all doing as an epidemiologist. So there are other roles. What we do is use the knowledge of, when we talk about cultural competencies, we should use our knowledge of specific socio-cultural factors among the population. See, there are certain communities, every community have their own cultural pattern or their own culture, or they have their own policies, right? Their rituals or something like that. So we should work with the community. We can't go against the community and then work. If the community believes in, let's say they believe in certain XYZ process, or their culture talks about drinking alcohol, we should understand that and then only try to work. We cannot directly go and give our principles to them and say, no, no, this is correct, this is not wrong. No. Understand what are the socio-cultural factors among the population, and based on that, take it forward. Work with the community, describe what is happening to the community, especially there are certain marginalized community where they are from backward ethnicity or poor educational background, okay, or they are sexual minorities or the religion, XYZ religion, or they are disabled. Let it be any population, try to understand that and then try to work with them and give a proper solution for them. We should establish a good relationship with the society, okay, be it any group for that matter. Okay, the epidemiologists have to do surveillance, especially where there are a lot of issues, health disparities with the community, maybe because of their cultural background, or they are underrepresented in wherever region they are. So we should identify them, okay, and then work with them and recommend certain health actions to the community based on what they have identified in these communities, taking into consideration the cultural background of the community. Okay. So I told you we also should have the financial planning and management skills. Okay. So when here this domain is important as any researcher, even a normal homemaker should have a good financial planning and management skills. Otherwise, it is very difficult to manage their home. So this particular skill the epidemiologist should have is he should be able to conduct all the activities. He needs financial resources for that. He should develop a plan for the organization. How does he going to do this particular research, or maybe the activities which they are supposed to do in the community? Okay. So that for that, we need to have a good financial planning and management skills. We have to implement whatever has been planned within the budget which is available. So we need to have a good financial planning skills. Okay. Assist in preparation of the proposals for extramural funding. Okay. So we as a organization, or maybe as a state, or as a scientific professional, we have to do a lot of research. So epidemiologists have to help in writing proposals, in preparation of the proposals. They have to give a lot of data. They have to give kind of strategic look to the proposal. Okay, a scientific background should be there for whatever proposals we are giving. So it should be very crisp. So that can be done by the epidemiologist. Should use all the management skills, people management, financial management, or maybe time management. All management skills should be used for getting our work done more efficiently and effectively. We should use the skills for collaboration. Management is one of the most important is getting a strong partnership. So epidemiologists should use their management skills to get the team working so that they can accomplish the goal what they are supposed to do. All the objectives of the program can be done only if every member in the community supports. So they should have that strong communication skill and getting the partnership skill, foster the collaboration between the community and other stakeholders to take the program. The last skill what we will be discussing, not the last skill, the leadership skills. Leadership skills is because we have to support, the epidemiologists have to support the perspective of an organization, especially in planning the processes, planning the study, planning the identification of problems. How are they going to investigate? How are they going to investigate an outbreak? So for that, we need to have a good leadership skill. Strategic planning skills are necessary. How do we take the organization? How do we take this particular study forward? So once we do a leadership, we should also have the monitoring skills. That is, how do we monitor whatever we have started? If we program, if we projects, no, we have to monitor that so that we can go on improving, whether it is moving in a right direction or no, where there is an issue. So that is the leadership skills and monitoring skills which is necessary for an epidemiologist. Most important of all, whatever we do should be done ethically. Because epidemiologists, we do a lot of research. That research, what we do should be more ethical. The practice should be more ethical, okay, and evidence-based. So that is why these skills are necessary for an epidemiologist. So we have to do all these things. So epidemiologists not only work in the public health or community. So they have a role in every aspect in healthcare, be it a hospital, or be it program planning, be it to administration, wherever health is coming here. So in hospitals, what is the role of an epidemiologist? So epidemiologists try to find out, like we have an infection control. Why there is a hospital-acquired infection? Why certain group of infections are spreading in my hospital? So something like that. How do we prevent? How do we take care of the community? How do we conduct? How do we reduce mortality rate in our hospital? So what is that? Why is that we are having a resistance to a certain antibiotics? Is that our policy of antibiotics is not correct? Or how do we modify these? So these are all the work what we do in the epidemiology as an epidemiologist. So for doing all these things, you should have a good leadership skills, because it's not that always the epidemiologists are leading. So they will be working. So they may be having others like healthcare professionals will be there. So they have to collaborate and work with them. So having a good leadership skills help in all these collaborations, working, monitoring. Okay. So we have to promote the workforce development. So that is what we have to work with the people. How do we promote that work? And not only by doing our research, we should also train people in doing all these kind of things. That's also a role of epidemiologists. Finally, coming to the skill, what they should have is program planning. Okay, so the epidemiologists have to bring the epidemiological perspective into development and analysis of all the public health policies. As a while ago, we were talking about the evidence-based policy of wearing seatbelt. So similarly, there are a lot of policies with the government which have come. They all come with kind of evidence. They're all evidence-based policies. Okay, so we have to analyze the data. Based on the data, we have to suggest to the policymakers. So this is what is the data telling. So you can take decisions like this. You can recommend to the policymakers. And once you recommend, the epidemiologists recommend, the policymakers can take an appropriate decision. That's a very important skill or activity of an epidemiologist to develop a program or an evidence-based policy. Finally, when we look at, to conclude, I would say epidemiologists have a diverse responsibilities. Like how, as I gave an analogy of an James Bond does He does investigate, he does identify, he does fighting, he does so many things. So similarly, an epidemiologist, they have diverse responsibilities for them in collecting the information, in analyzing the data, in communicating that to the people and getting the evidence policies done. All these diverse activities are to deliver good public health service and combat all the biological threats which is coming, or the public health threats to the community, control and prevent them. That is a main role. Identify, describe, identify the problem and find out why things are occurring, and then try to control them. This is the main activity, so that we can have a good public health service to the people and reduce the health disease burden in the community. This is the main uh, activity or a role of an epidemiologist. Okay. So with that, I try to conclude. So we had at the end of the session, are you able to now define epidemiology? We know what is epidemiology. Now we are able to discuss what is the role of an epidemiologist. We know what are the activities, what they do. And we also now know what are the skills and competencies of an epidemiologist, what is necessary and what he should do. With that, I conclude my session. Thank you.